This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
My name is Evan Alexander. I'm one of the PGY4s at EVMS. I'm also the chief resident here. And I'm going to pull up our PowerPoint.
Mike Guju, PGY4 EVMS, also present.
Kyle Stoitsky, I'm a PGY2. I'm here too from EVMS.
Taylor Drake, PGY2 EVMS as well.
All right. So program was founded in 1985. Comprehensive clinical training in both inpatient and outpatient. Our main hospital that we rotate at is Centera Norfolk General in Eastern Virginia. It's right next to Virginia Beach. It's a 525 bed level 1 trauma center. There's also a heart hospital there. So we see everything from stroke, multiple trauma, burns, complicated patients, gunshot wounds. Our PM&R faculty that we have as far as both core as well as community faculty have fellowship training in neuromuscular medicine, pain medicine, sports medicine, and pediatric rehabilitation. Learn the gamut of everything required as far as PM&R, from electrodiagnostics, interventional procedures, Botox, P&O, ultrasound, and myriad other things, MSK as well as fluoro, and very good faculty to resident ratio. As far as our faculty, our core faculty is listed above with our program director, Dr. Robert Satwater, and then our pain fellowship director, Dr. Quigley there, and then you can see our community faculty listed below. A few of them are I didn't have pictures for, so not listed there. As far as the residents, you can see Mike and me on the bottom there, and then Taylor and Kyle up above. You can see everybody comes from all over the country, really, as well as from other countries as well. We have Dr. Sunol coming from Turkey. And we have 9 residents altogether, 3 per year. These are some pictures of the different sites that we'll rotate at. So Andrews Hall is where we do our pain medicine, as well as most of our pain, as well as our outpatient EMG and MSK stuff. We have 1 C-arm that's over there. And Centera Norfolk General, as I said before, that's the main hospital that we rotate at for our IPR. It's a 525 bed level 1 trauma, and specifically for our IPR, it's a 16 bed IPR. Our Hampton VA that we rotate at, it's this area, because it's in Virginia Beach, has one of the largest military populations, both active duty as well as veterans in the country. So they see a large volume of veterans there, and we do our spinal cord injury rotation there. CHKD, Children's Hospital of the King's Daughters, is a roughly 200 bed hospital. It is the only standalone children's hospital in the state. The IPR was renovated in 2019, and they'll pull from not only Virginia but from other states, and they're able to take ventilated patients over there as well. And then Centera Virginia Beach is one of the other main hospitals. There are several private practice that I didn't include pictures of, but there's an 8-bed IPR that we rotate at there. This is kind of a map showing where each of the different sites are that I mentioned. So over here, the Hampton V8s, as far as most people will live in the Norfolk area or Ghent area, and it's about 30 minutes, depending on traffic, through the tunnel over there. And then some of the Virginia Beach, you can see with the pins over here, sites, those are also about 30 minutes away. And CHKD is right next to Centaur Norfolk General. As far as our rotations go, pretty much an even split between inpatient and outpatient. So inpatient over the course of 4 years, 13 months that we spend on that, and then 15 months doing outpatient. 8 months we spend doing other rotations, which include general consults, as well as trauma consult service. And then there are 2 months of elective as it is now, split between PGY 3 and 4. Each of the rotations are anywhere from 1 to 2 blocks. It just varies depending on which rotation you're on. I know this is kind of a confusing slide, but you can see, at least over on the side here, if you want to see kind of the different rotations and what they're labeled. I have it color coded, so basically all the blue is the 2s, all the green is the 3s, and then all the red is the 4s. For our didactics, we basically have a 12-month rotating didactic schedule, 70% of which is attending led, and 30% of which is resident led. We have a block schedule is how we do it. So basically 1 block at a time. Start off with our introductory didactics, then stroke, TBI, SCI, neuromuscular and EMG, P&O, pediatrics. For sports, we have integrated into our sports and MSK. We have a diagnostic ultrasound curriculum, pain, and then kind of just a gambit of different things that we've encompassed under medical. And then we get into some more business, ethical didactics as well, M&M type of didactics. Additional educational opportunities that are for EVMS residents. So like I said, the musculoskeletal ultrasound curriculum is headed up by a family med sports med doc, Dr. Patel. He's RMSK certified, as well as sports medicine certified. We have a cadaver course where we work with the medical school's anatomy professor. We also are able to use the cadaver lab for doing any of our interventional workshops that we have. We have radiology didactics where we work with the radiology residency program, and they give us access to basically any of their didactics that we would like to go to, and so we get to pick and choose. It's a great resource. Journal Club we have once a week while you're on either the IPR or consult rotations. And then there's the EVMS sponsors a board review course, which is a week-long course. It's provided through Mayo Clinic at the end of your 4th year. And then a great educational opportunity for med students who are rotating on several of our different rotations. Additional clinical opportunities. So there's the HOPES Clinic. This is supervised by the Family Medicine Residency. It's offered for twice a month, and several different things that are provided at that clinic: ultrasound, drug point injections, OMM if you're a DO. There's on-site physical therapy as well as simple joint injections. ODU is Old Dominion University. It's a local Division I level college that's just about less than 10 minutes away from our main hospital. And some of the residents will often go over for football sideline coverage. There's also the Monarch Clinic, which is their physical therapy, occupational therapy clinic that they have there. They work with pediatrics. They have specific therapists for pediatric stroke, SCI, Parkinson's, and hand therapy. Kaizen Athletics is a great resource for our residents. They are an adaptive sports gym. It's CrossFit style, and it's non-for-profit. So it's a great opportunity for patients who've exhausted insurance requirements and are still very motivated to stay fit. And then Sportables, which is a little bit further away, up in Richmond, which is about an hour and a half away. They have numerous different leagues for anybody with adaptive needs. Research exposure, we have a group on campus called HADCs, so they help out with any statistics or literature review if you're interested in research. Old Dominion University, Mike, who's on this, he's working closely with them and their engineering department for collaboration, which has been an incredible resource, and I've been on the project with him as well. EVMS, obviously lots of just medical students and other faculty to work with there. As far as our call goes, call is, it's home call, and during the week it's 5 p.m. to 7 a.m. You do it for a full week at a time, and then on the weekends, you go in and you cover any consultations that came up over the weekend, as well as IPR, the 16-bed unit that we have. As far as the requirements per year, it's 8 weeks for PGY2, 6 weeks for PGY3, and 3 weeks for PGY4. As far as moonlighting opportunities, you have to be a PGY3 and have taken STEP or level 3, and most residents will moonlight at the local urgent care. Usually there aren't too many other opportunities, although I know some people have done other things in the past. As far as benefits go, I've listed the salaries, the current salaries, although those usually go up a little bit every year for 2 through 4. The obviously included is health, dental, vision, disability, and professional insurance. PTO, we get 15 days off. Sick leave is 20 days. Educational days, so like for conference or any CME, would be 5 days. Additional resources that residents get. So when you come in as a PGY2, so these are different board review books, as well as Easy EMG, which is another book for obviously with EMG. There's a book fund of $350 a year, and then if you're presenting at a conference, then you get up to $2,000 a year. Recent graduates, so I have them listed by year. So this past year, the most recent fellows, most recent residents are going into pain medicine fellowship at UPMC. One is working at IPR in Rhode Island, and one is going to Texas for pediatric fellowship. The year before that, pain medicine, University of Kentucky, pain medicine, one stuck around at EVMS, and then one went into private practice, general rehab / pain. And then the year before that was went to pediatric fellowship, sports medicine, and the other one started up an IPR in California. Why this area? This area is incredible. This picture says a lot, obviously. Just yesterday, most of the residents, we were out at this beach. The water is great. Usually you can get in the water from maybe like late May to mid-September, so it stays pretty warm. This picture, so waterside, so this is downtown Norfolk. This is basically right next to where the our main campus is and where most people stay, the Waterside District. There are a whole bunch of bars, restaurants. There's a pavilion where they'll have concerts or festivals as well. So it's a very lively area. Lots of great food there. With the military presence, like I said before, there's really neat walks that you can do on, for example, this World War II battleship. There's an aquarium that's downtown. This is a picture from First Landing State Park, which is a local park where we went to recently for a pontoon boat trip, and there are plenty of hikes there. So for each of those things, so just going back to the map one more time, so all the downtown stuff is here, as well as Centura, Norfolk General, as I said before. First Landing State Park about 30 minutes away, and then Virginia Beach about 30 minutes away. I think I got a minute more before I guess we got to go to questions. Like I said, lots of great food in the area. During the summer, they have Restaurant Week here. As you can see, it's very popular downtown. I believe that's taken during Restaurant Week. Shenandoah National Park, about 2.5 hours away, some absolutely gorgeous hikes. And then also about an hour away is Colonial Williamsburg, first settlement in the United States, as well as close to the end of the Revolutionary War. So lots of historical places to visit. And then lastly, I have some pictures from our resident wellness, just getting together and hanging out. I don't want to take up too much time though, because I do want to get to questions if anybody has any. And I'm going to leave up this slide of our residency coordinator, Kira Smith, if anybody needs anything. But I'll open it up for questions.
That was incredible timing. You got a little bit over 5 minutes left.
Feel free to put them in the chat too if you don't want to speak up.
I can just kind of add my 2 cents. PGY4, so kind of wrapping things up here. It's been a fantastic program. I didn't know much about Norfolk or Virginia Beach before we moved out here, but it's been an absolutely fantastic place to train and to live. And the engineering collaboration with ODU. I see a question in the chat. So yeah, I can talk about that. So I had a particular interest in research and development. Basically, I had an idea for a medical device, and I reached out directly to the chairman of engineering at Old Dominion University that I had an idea. We got to talking. He gave me a group of graduate students, and we have 3D printed a medical device, and patent went out end of March. So this is overall just a resource-rich area that if you have ideas like I did, Kyle actually also has a patent out. So that wasn't in conjunction with Old Dominion, but if he wants to get hooked up there, I'm sure we can make that happen. So yeah, it's a resource-rich area, and there's an ample amount of opportunities that if you want to search something out, it's there. I hope that answered your question. Oh, thank you.
Yeah, I mean, so I'm a PGY2, so I've only been here about a month. So I can only kind of give you my experience of moving from intern year to here. I live right downtown. So when Eben showed you that picture of that destroyer, I can actually point to it behind my apartment, which is great. So for the past, month and a half that I've been here, very much enjoyed my time. Downtown's great. It's fairly small, so you can pretty much walk wherever you'd like to. And yeah, it's just been a great time so far, just 1 month in.
I see there's a question about residents with families and kids. I feel like there's quite a few in our residency program.
Yeah, we have a lot of kids.
Yeah, I think so. We've already had some families hang out, so that's kind of nice. And the kids are like from 0 to 5, so it's a good amount. I myself don't know if you see them in the background, but my kids have come in every once in a while. Virginia Beach is where I live. It's a great spot for like doing things with families, and like we went to the beach today. There's one beach we go to that has like no waves at all, so we just went and we hung out in the rain and had fun on the beach. It was really nice, but it's a good spot for families. A lot of young families.
My wife is due a week from tomorrow with our second child. First baby was born at Norfolk General. Second kid's going to be born at Norfolk General. So yeah, it's a great place. We've loved having our kids here. If you have older kids, definitely the Virginia Beach area has some really elite schools. So if they're more like school age, probably moving in that area, which again, it's like maybe a 15-minute commute.
And then I think close out of time here, but I see there was another question about international medical grads, and yeah, we've had several international medical grads in the last several years I can think of.
Awesome. Well, thank you so much to the group of EVMS. It's nice to see Dr. Alexander. I met him as a medical student. Now he's moving on to being an attending soon. So it's pretty cool seeing things come full circle.